Good morning, student. There is another method of contraception of terminating the pregnancy that is known as medical termination of pregnancy or induced abortion. Now, this is the method which can terminate the pregnancy, but this method has been illegalized in India. Now, earlier in 1971 it was legalized, but as people were using it for female feticide, now this method has been banned in India. This method can only be done in the cases if the pregnancies are due to the rape cases, or if there is a disorder in the individual which is undergoing the development within the womb of the mother. The disorder like the genetical disorders or the developmental disorders, where the developmental deformity is there, or the genetical disorders have been proven, like they are suffering from any of the disease which can be a burden on the society after the birth. In such cases, this is recommended. But now, by the will of the individual, medical termination of pregnancy is not being allowed in India. Now, if we consider this medical termination of pregnancy is very safe during the first trimester, that is the first 3 months of the pregnancy, that is up to the 12th week, because this abortion or the induced abortion can be done with the help of a medicines or minor surgery. But after that, second to third trimester, it is unsafeful and may lead to the death also of the mother. But still, it has been observed that around 45 to 50 million people throughout the world, they are undergoing this method of decreasing the population. But in India, this is not a very commonly used method because it is considered illegal, as in India it is generally leading to female feticide. But some of the quacks or the sadhus, they are still doing this by giving their medicines or the Ayurvedic medicines, which is harmful to the individual who is undertaking this process. So this process was initiated by government of India, but later they found that it is there was an indiscrimination and the illegal female feticides has been reported in India. So this process was banned. The next topic for today is a sexually transmitted disease, also known as venereal diseases or reproductive tract infection. Some of the STDs which are very commonly are the gonorrhea, syphilis, genital herpes, trichomoniasis, hepatitis B, AIDS. Now remember, hepatitis B and AIDS, these are those STDs which do not affect the reproductive organ. They affect the other part of the body, like the AIDS, it affects the immune system, whereas the hepatitis affects the liver, whereas other, they directly affect the reproductive part or the reproductive tract. So what are the early symptoms when it is seen? That is, one is the itching, followed by fluid discharge is there, swelling is there, then there is a swelling in the regions of the genitalia, itching is there, these are the, or irritation is there. So if the patient do not detect these things or remain undetected and untreated, these symptoms may increase in them and they may transmit this disease to the other person. Now remember, it is not always that the STDs have been transmitted through the sexual act only. As we all know that there are other method of transmission of AIDS, hepatitis, which can pass through the water, or from, even if the infected clothes come in contact with each other, they can be transmitted like syphilis, gonorrhea. Now remember, the AIDS and the hepatitis are still not curable, but the other, if they are detected in early stages, they can be easily cured. But if they are not detected or they cause the infection, they may lead to infertility also, because the internal lining of both the tracts of male and the female will be affected. So the development of their gametes will be affected. In the female, they may cause these pelvic inflammatory diseases. That is, the inflammation in the pelvic or the uterus region may cause abortions, stillbirth. That is a birth of a baby which is not alive. Ectopic pregnancies, that is the pregnancies as the implantation occur in the uterus. Here the implantation, if the uterus is having the infection, the implantation may occur in the fallopian tube or in the cervix region, lower part. So that are known as ectopic pregnancy, and as I have already told you, it may lead to infertility and the cancers of the reproductive tracts. So as in the age group of 15 to 24, where the reproductive organ are highly functional, as we know that they are giving out, the semen is coming out, vaginal fluid is coming out, which is highly nutritive, which contains the nutrients. So the chance of growth of these microbes is more in this age group. So these age group have a more potency or more potent to these type of disorder. The measures can be taken to prevent this. Number one is to avoid the sexual practices with the unknown partner or the multiple partner whom we do not know whether there is a chance of spread of infection or not. In such cases, that should be avoided. The second is the use of condoms when you are going for a coitus with an unknown partner, or in such cases the condoms can be one of the method which can prevent you from STDs. And if the individual finds that there is symptoms of the allergy or the infections in the reproductive tract region or the pelvic region, he or she must visit the doctor immediately, because these organs should also be taken care like the other parts of the body. As we take care of the teeth every day, eyes every day, similarly they should be taken care regularly.